the OET free webinar regarding speaking. Before we can start, can you please tell me that all of you can hear me? Okay. Well, thank you for your feedback. Well, my name is Dr. Umair, and I'll be doing the OET speaking free webinar with you today. And a special thanks to Med Exam Expert, and they provided me this platform with which I am going to discuss and guide you through OET speaking specially. So basically this specific webinar is dedicated for speaking, and we will discuss a lot of things regarding OET speaking, how to ace this exam, and what are the main components we should take into consideration while considering the challenges faced during OET speaking by the candidates. So we will wait for a couple of minutes before the maximum people can join, and then we will move towards our presentation and our main crux of OET speaking. So let's begin with the what is OET speaking. Let me make you familiarize with OET speaking. So basically OET is a test which is taken by mostly health professionals. There are other fields as well, but while we discuss about doctors specifically, so OET speaking is a sub-component of OET test. Other components are writing, reading, listening, okay, and then comes the speaking. So basically, what is our goal when we are discussing and all of you are attending this session? What is our goal? Mainly our goal is to secure 350 marks or get a B grade in OET speaking. And I hope all of you can listen me and everything is going smooth right now. And while we wait for other participants, I'm just giving you a demo about what is OET speaking and why it is very significant to have a good grip on OET speaking. And later on in this free webinar, we will discuss about tips and tricks on how to pass OET. So we were discussing about it as a component of OET, and it is very necessary to pass all components of OET with a minimum score of 350, especially if you are going to apply for PLAB 1 or for the purpose of Irish Medical Council registration. Okay, so basically what is OET speaking? OET speaking is basically an interaction between a participant or a candidate who is going to appear in the OET and an interloculator, which is nominated by the Australian Council, which is responsible for conducting OET. Okay, so let's move to our main crux of presentation about OET speaking. So right now I am going to share my screen with you, and we are moving towards our main goal, which is OET speaking webinar. So I am Dr. Umair, and I am a doctor, and I'll be conducting today's webinar, and I'll be guiding you through to tips and tricks on how to pass OET. So basically, what is OET speaking? As I told you that it is a subtest of OET, and OET is basically an occupational English test, and right now we are targeting the health. Right now we are focusing on doctors. So basically it consists of two role plays. Basically, when we will be going to attend OET and you will take it, first of all you will have listening, then you will have reading, then you will have writing, and then you will have a time specified for you for OET speaking. So basically, when you will enter in a room where you are specified time for OET speaking, you will be given 2 role plays, and each role play consists of 5 minutes. So basically, you have to complete every role play in 5 minutes. And don't worry, I'll take you step by step on how to pass it. So how to break down OET speaking, how to simplify it. Basically, you will be specified a time, you will be that you have a dedicated time for you, and you will have that specified time that will be dedicated for your speaking, and each and every candidate will have his or her time. So you will be notified the time after your writing, and you will enter in a room with interlocutor sitting beside a desk. Okay. So you will sit in front of him and you will familiarize with him and get to know his accent, and he will try to make you comfortable. There is nothing to worry about it. You will enter in a room and there will be a desk, and he will be sitting on the other side of a desk, and you will sit in front of him. And he will try to ask you a few casual questions about your education, about your career, about your future ambitions. And please consider that these will not be marked. Okay. After that, you will be handed over a role play card, and you will be given 3 minutes to read it. Okay. So this is important. Basically, when he will familiarize with you, you will be handed over a role play card and you will read it. And all of you who are doctors know well, or have you ever came across any role play card that there is a scenario written in it. So basically, it will be about some kind of disease, and it will be mostly about any kind of medical condition, and there will be a few questions. And how are we going to do it? We will be discussing it further. So then you will be having 5 minutes to act as a doctor, and interlocutor will act as a patient. So these are basically the basics of OET speaking. You will be acting as a doctor, and the interlocutor will act as a patient. Okay. So basically, this is basically a role play in which you are going to act, as I'm repeating it again, you will be becoming a doctor and the other person will be behaving as a patient. So basically, these there are two scenarios which you are going to do, and it is called a role play. And while moving on our next slide, basically our aim is to ace this exam. Okay, so we will be discussing the tips and tricks on how to pass this exam. So first of all, the most important things which we ignore is, first of all, you have to greet the interlocutor. It doesn't carry any mark, but I am hopeful that whenever you greet a person, then you develop an amicable sense with him, and it will be easier for you to familiarize with him. Okay, which is very important, which we will discuss further in our discussion. So when doing casual discussion before roleplay starts, I will prefer asking him to please adjust according to your accent and speed of speaking. And believe me, it helps. So basically what I am trying to say is that when you sit in front of him and you talk with him, and he asks you a few questions about you, about your personality, about your career, about your future goals, what I believe is that you request him that would you mind adjusting your speed and your accent according to me, and I strongly believe that it will be helpful for me in passing the exam. And believe me that that interlocutor will have no problem in it. Before the role play starts, use those 3 minutes to underline the tasks. So basically this is important. This is basically an introductory webinar. When we'll be discussing it in further and in depth, then we will discuss on how to underline. So basically, there are a few tasks written in that role play which you have to underline. And why are we underlining it? Because those tasks carry weightage. Each and every task carry weightage. If you are performing the role play well, if you have a good grip in English and you can speak well, but you aren't completing the tasks, then most probably you won't be able this exam. So basically, you have to basically complete the tasks. Okay. So next tip is underline. Underline the specific task which you are expected to do. So it will break down, and while you will be talking to that interloculator, when it will be recorded, please bear in mind that whatever you will say during that specific time, other than casual discussion, it will be recorded and it will be sent for official marking. That casual discussion won't be marked, but that 5 minutes of role play each twice will be sent for marking. So they will see that, first of all, one of the things they will see that how many tasks you finished. But it is important to note that you have to have a very good sense of communication with the interloculator who will be acting as a patient. You also have to complete the tasks, but if there is, there sometimes there is a scenario in which there is a long scenario in which you aren't able to complete it, then it doesn't matter as long as you are empathetic. Please drill this word in your mind, and I can't stress enough about it. OET speaking is all about empathy. Well, most of you know what is empathy. Basically, you are dealing with the patient, and which will be acted by the interloculator. And in OET speaking, what they are trying to figure out is that how much empathy you have. You have to be empathetic. What is the benefit of it? I think the number you score in OET speaking is directly proportional to the empathy you will have during your OET speaking. So why does it matter? Basically, as we are giving this exam for UK or Irish pathway, they are looking for doctors who are empathetic towards the patient. There's a little difference in our social norms when we compare it to the UK or Ireland. So basically, you have to be empathetic. I don't mean that you don't have to be empathetic in Pakistan or any other third world countries, but what I believe is important in this discussion is that you have to be empathetic in OET speaking to secure good marks, and I can't stress enough about it. Then there comes the counseling of the patient. So first one is empathy and second one is counseling. Counseling is as important as empathy, and I think these two terms are mostly synonymous. So there will be few questions in the role play in which the patient will be a bit giving you a tough time, or he can be acting up like a very tough person. So you have to be empathetic and you have to counsel and you have to address the concerns of that patient. So I really hope that all of you are listening and it's going well on your side, and there is not any interference in our discussion. So next tip is use open-ended questions. This is very important. What I mean about it is that when you are talking to the interloculator, always try to ask open-ended questions. For example, I can give you an example. If that patient is saying that I am having the pain, so you won't say that I'm so sorry that you have pain, but you have to ask leading questions, open-ended questions. You don't want to enter a blind alley. I think what I believe will be helpful for you is that you should ask that patient that I'm so sorry to hear that you are having this pain. Would you mind telling me that what is the most painful area of your body, how it radiates, all of the factors which are aggravating it, all of the factors that are relieving it. So you can use your medical knowledge as well as your general knowledge to, or your IQ to ask open-ended questions. Well, basically this is this is an imitation of real life scenarios. You have to be normal, you have to be, you don't have to fabricate or act on it. So basically, if that person is persistent, if that patient is saying that he's suffering from any problem, when you will ask open-ended questions, when you will be empathetic, when you will be counseling him, then I strongly believe that you will be able to secure good marks. So next is engage the patient. So basically, when you will be asking the questions from the patient, you don't want to be acting like this any kind of one-way discussion. You have to ask a few questions. Okay, you have to take feedback from the patient. You have to make it look like a two-way discussion, like it is mostly in our hospitals. And you shouldn't be delivering a speech there. You should be taking feedback, like for example, if that patient is suffering from any pain, so how will you engage the patient? You will say, I am so much concerned about your condition, and I want to prescribe you some anti-inflammatory drugs or any painkillers. How do you feel about that? As every doctor will prescribe the drugs, but what is important for OET speaking is that you will be engaging and getting the feedback from the patient, that how he feels about it. Has he heard about this drug? Will he be taking it if I prescribe it? Okay, so you have to make it look like a very, you have to do it in a very friendly manner, that the patient is easy and he will be discussing it with you, his or her problems. Then comes don't judge. So this is very important when we talk about UK, that you have to be very neutral about any condition, whether it is psychiatric condition or any other medical condition. You cannot judge the patient. Okay, patient is the supreme importance. You have to give supreme importance to the patient, and you have to be neutral about it, and you have to show your concerns. And being a doctor, it is your moral duty that you never judge the patient, whatever the condition is. So you also keep it in mind that you must not use any derogatory remarks or any remarks that may show judgment. For example, if the patient uh, is a chronic smoker, then you have to use the phrases that not show judgment. You have to use neutral words, like for example, I know, I understand your condition, I know your concern, I know that you like smoking, I know you love smoking, that but don't you think that it is injurious to health? Like, you ask his opinion rather than you know delivering your concerns or telling your concerns in a judgy manner. So I hope all of you are listening to me. Can anyone give me any audio feedback that can you hear me properly? Are you with me?
Yeah.
Yes, sir, we can hear you.
So that is a classical example of engaging the patient and getting the feedback from the patient. If I started this lecture and I delivered it without listening to you, so that won't help me good marks in OET speaking. When I asked you, your mind became active and you responded, and it felt like a two-way discussion. So when you will engage the patient, when you will get feedback from the patient, then it will help you in securing good marks. And believe me, OET speaking is very easy. There are many tips and tricks you will learn, and you must learn to pass this. So basically, this webinar is not completely encircling all aspects of OET speaking. This is just a few tips and tricks on how to pass. There are many courses and there are many mocks exam which med exam expert is arranging for you guys to pass this exam, and you can contact the coordinator, which is Miss Ramesh, and she will guide you further on how to take, like for example, if your exam is in November, you can take October classes. And we have the mock exams as well. Then we have the full-fledged course. Okay, so you can get the details from Mr. Ramesh about the different courses and mock exams we are offering. So basically, what is our goal? Our goal is here to facilitate you step by step in passing OET. And I hope that you people are getting my point. So right now, is there any question? Feel free to ask any question about OET speaking.
My question is that is the accent matter while speaking, and if I'm taking on the live Zoom at my home, does it be different from the at venue?
So what I get from your question is that you are asking about the difference between OET on paper and OET in person, right?
Right. Answer: I'm taking at home, OET at home, speaking subset.
Well, I believe that all the tips and tricks I'm telling you that you have to stick with it. When we talk about specifically about speaking, it doesn't matter. It's just like if you talk to someone in person or you talk online like we are talking, it doesn't matter. You have to stick with the plan. You have to stick with the tips which I'm telling you, or you will learn by yourself, or you will learn through the course, and you have to stick with the pitch. There are few pitches, there are few sentences, there are few terms that you have to memorize, and you have to incorporate in your language to pass this exam. So addressing your question, I don't think that there's a lot of difference. It's just that you have to practice it. You have to practice a lot, and I can't stress about it enough. And you have to give any mock exam like we are arranging, and I really believe that will be helpful. So any other question up till now?
Sir, I have a question.
Sure.
Sir, what will we do if our interloculator will not read his own role play?
Will not?
He will not saying the lines which given to him.
Okay, so that is a very good question. Can you please tell me your name?
Saad, Muhammad Saad.
Okay. Okay, Mohammed Saad. So that is a very good question. And when I personally gave OET, I underwent the same circumstances, but it is very easy. If you have a good grip on English, if you have good command on English, and if you have a good sense of English of OET speaking and you have practiced it well, they are basically what you are trying to say is that if the interlocutor is skipping any question or he is going at any other pace and is not going in sync with you, so it will disturb you. It happens. But in layman terms, I would say that you have to go to the interlocutor, hold his hand, and bring him back to your level. How will you do it? So you will do it like, for example, he will say he skips a question in which he has to ask about the type of painkillers, but he's going one question further. So you will say in your question, wouldn't be appropriate if we discuss the any options of painkillers? How will you feel about that? So when you will ask an open-ended question of that specific scenario which is he or she has skipped, it will help you in becoming in sync with that interlocutor. You got my point?
Yes, sir. Thank you.
Okay. So we will move out to our next slide, and it is going really well. And
Excuse me, sir.
Yes, sure.
Sir, I have asked a question already that in every task we are giving with like 3, 4 things or 4, 5 things to be discussed. Should we move on ourselves or should we wait for the patient or interlocutor to ask the question? Like in everyday life, if we are watching some patient, we are telling that we are going to discuss the management options. Before that, I'm going to examine you. Like, should we follow the card by ourselves or let the person ask the question?
Okay, so that is a very important question as well. Like from my experience, I can tell you that when I appeared in an exam, uh, in most of the role play cards, they are telling you to examine the patient. And how you do it, you will say that what I believe is important for you that I do an examination of you. Will you mind that? How do you feel about that? And you ask that, and the patient gives the consent. So after a pause, you say that, okay, thank you so much. I've done your examination. This is the normal tone and normal pitch. But sometimes it happens that even they have told you in the scenario that you have done the examination and these are the findings. How will you open that sentence? You will not discontinue your pitch. You will introduce yourself, like, for example, hello, my name is Dr. Umair, and I'll be your treating physician for today. How may I address you? Okay. So if I am going to open with this line, you will stick with it. And after that, you will say that, as I did your examination, these were the findings. Okay. You can say like that, or you can also say like that, that I would like to do an examination of you. So it totally depends on the scenario. You have to be confident, and you, when you are given those 3 minutes to filter out and underline the task you are required to do, that is the time you decide that how are you taking this scenario and how you are going to perform in this scenario. There's nothing to be worried about. There's not a particular, you can say that, pattern you have to follow. You just have to be doctor, and you just have to believe in yourself, and you just have to do this role play like any other normal conversation you do in the hospital. So did I address your concern?
Yes, sir.
Okay, so let's move to the forward, and we will ask more questions at the end of this webinar. And I'm so happy that this webinar is going well, and it is a very interactive session, and I'm loving it. So next tip is be polite. So as you know that there are different social norms of any country in the world, but what's the major difference between, if we talk about third world countries like Pakistan, India, and when we compare it to the UK, they are very polite people mostly. And when you will be doing the OET speaking in a very rough or casual language, or your accent won't be nice, or your body language won't be nice, you have to basically do that acting as well with your accent. You have to be polite. You have to make that patient comfortable, and you can't do this without being nice, polite, and friendly. Try to wind it up, but also don't be too fast. So basically, you will have 5 minutes to complete the scenario. But if you will be too slow, you will leave many tasks unfinished. If you will be too fast, you will complete it before time. So there will be some role plays which will be done in less than 4 minutes, and there will be role plays which will take more than 5 minutes. So basically try to complete as much task as you can. But even if you don't complete the scenario, but you are doing well, if you have a good grip, if you have a good opening line, if you have learned all tips and tricks, and you have did good practice and you perform well, but if you aren't able to complete the 1 or 2 tasks, it doesn't matter, you are going to pass, believe it, inshallah. Okay. So that get constant feedback. This feedback or engaging the patient is not necessary on only one step. You have to take constant feedback from the patient. For example, if the patient's, you can say that you have run some test, and you got the diagnosis of rheumatoid arthritis, and you break that news to the patient. You will say that, I'm so sorry to break this news to you that you are suffering from rheumatoid arthritis. Um, and how do you feel about that? Okay. So basically, in every sentence, at the end of every sentence, you ask a feedback word or feedback phrase or sentence that will be engaging the patient. And believe me, if you use these strategies, you will ace this exam with flying colors. So next important thing is avoid using fake accent. So this is very important. We people who belong to the third world countries like Pakistan, India, Bangladesh. So our accent is not will can never be at par with UK accent. Okay, because it is their mother language and they have a natural accent. But no matter how good our English is, if we will fake it, then it can mark a negative impact on our OET speaking marking. So be natural, use your original accent. Don't try to be fake, or don't try to be be more fancy in your accent. Okay, because if you will be faking it, then you won't be able to concentrate on your task and other tips I told you. So be natural, act like you are a doctor and you are dealing with a patient, just in English language. So be very concerned about the patient. I will say that in layman terms, that you act like just that patient is a very close relative of you. If I summarize this, be very concerned about the patient. You just you know think about that patient or interlocutor is a very close relative of you. Be very concerned. Like, for example, if that patient says that I am suffering from pain, and while he will be talking about that pain, you know you should be using there some phrases, or body language, or you can say that, oh my god, okay, I can understand. Oh, I see. So no, these phrases while the patient is will be talking, these can also help you ace the exam, and you can get good marks in it. So you have to do the counseling of the patient. So basically, OET speaking is all about counseling. You know, you will be getting the scenarios in which there will be third or fourth question in which the patient will be, in denial of his diagnosis, or he will be reluctant to use any medication, or he will be having a firm belief that any medication is, necessary for his survival, while you will be of medical opinion that that medication is not, useful to him. So basically, whatever the scenario is, you have to counsel the patient according to the scenario. You have to be polite, you have to be natural, you have to be very concerned, and at the end, at the end, and the foremost important thing is be empathetic. You know, how you can be empathetic, although we will discuss in details in our coming webinars, and we will break that OET speaking into steps, and we will discuss all the steps, all the important points, terms, phrases we can ace the exam. But about empathy, like, if that patient says that, you got the diagnosis that he's suffering from cancer. So after breaking the news, he tells you that I am very depressed. How you will be empathetic? You can say that, I'm so sorry to hear that. And you can also say that, I totally understand your concern. And you can also say that it's totally normal to feel like that in your situation. So these are kind of the sentences you can say to be more empathetic. Okay. And there are many other ways as well, many other terms and phrases as well. So these were the few examples, and I tried my best to tell you all those tips and tricks on how to ace this OET speaking. But what I believe is that there are lots of things that cannot be covered in one webinar, and we will be having more interactive sessions with you. And I firmly believe that you learned something today. And if I summarize this webinar, I will say to stick with two things. Number one is counseling, and number two is empathy. As long as you are showing these two things and you're being natural, there's a very bright chance that you will be securing good marks and you will be acing your exam. So right now is the time to ask any questions. If you have any query, please do not hesitate to ask.
I want to say that can you start this webinar on writing and listening as well?
Well, that depends. If you guys good feedback, we can maybe moving about other aspects and other subtests of writing, listening, and reading. But today's webinar is about OET speaking. First of all, can you please tell me how was it, and did you learn anything new
Yeah,
about it?
yeah, it was very helpful. First, it was very helpful. We learned so many new things like being how can you be asking open-ended questions. I think that's very important to ask open-ended questions because the to ask open-ended questions is very important for the patient as well.
Yes. So basically, it's all about, we are at Med Exam Expert. We are trying to help you ace this exam. We are here to tell you the tips and tricks you can use to ace this exam. So this was first baby step. It was my first webinar, and I hope I did well. And it was about OET speaking. But if you guys feel like that we should do more sessions like this on OET speaking or other subtests, then definitely we can arrange that as well.
Can
Yeah,
I ask
it would
something?
be, I would be very thankful if you arrange it on other aspects as well.
Okay, sure. Don't forget to give your feedback in our WhatsApp group, and also try to mention the subtest in which you are more confused, and we'll definitely try to arrange more webinars on it. So any other questions?
Yeah,
Dr.
I
Umair,
just uh, hello. May
Yes,
I ask?
yes, sure. Go ahead, please.
Okay, can you please tell me how many open-ended questions and close-ended questions should be there in a role play? Like the ratio of the type of questions.
Well, I think that the most important thing that can answer this query is that when you are, after learning the steps or each and every step about OET speaking, the most important thing is practice. When you will be doing mock speaking sessions, like for example with us at Med Exam Expert, so you will be having a real scenario based role plays, and you will be able to know that how much time you take in completing a role play. For example, if you are good in speaking and you complete your role play in 4.5 minutes, so you can easily ask more questions. If you are comfortable, if you have grip on English language, then you can ask as many as you can. But it totally depends on the person, his or her English proficiency. So I think that that answer will be questioned when you will be having mock sessions with us, when you will be doing practice.
Alright, thank you.
And sir,
Dr.
my
Umair,
question is that will it affect our score if we are summarizing just to tackle the time?
Yeah, that's a very good question. And I think that should be, discussed in detail as well. So basically, summary is very important. As I told you that it is very difficult to, summarize all the tips and tricks in one webinar. One of the important tip is to summarize all you have told you, and that comes under the heading of taking the feedback, engaging the patient, as I told you in my webinar. When you will be taking the feedback from the patient, so basically summarizing all the role play at the end is taking the feedback from the patient. You tell him, like for example, you do a role play and you say, so let's discuss what we have learned today. We have learned that smoking is very injurious to health. How you feel about that? Then you will discuss the management strategies. Then you will tell him that please don't forget to take the brochures from the reception as well. So basically summary is very important. If you have time, you can summarize and take as much time as you can. Okay, there are few role plays which are very short, which may take 3 minutes. So you should summarize. You can engage the patient, and if you summarize, and hopefully you can ace the exam in more flying colors. So any other question?
Hello.
Yes, please go ahead.
Yeah, sir, I have one confusion. Now, how to introduce when there is a follow-up visit or when the patient is not there, like attendant, son or daughter. So how to open the discussion?
For example, can you give an example?
Like a son or daughter is there regarding his father, or sometimes mother. How to open this discussion with mother or son of a patient?
So I think this is a very straightforward query. For example, if there was a patient and his mother comes to visit you, and you are asking about the opening sentence, you can say that normally you say like, for example, hello, my name is Dr. Umair and I'll be your treating physician for today. How may I address you? So it starts from addressing. But when you already have been told in the scenario that that person is the mother of the patient you have seen. So you will open your discussion like that. There are two ways of opening this role play. Like you can say that, hello, my name is Dr. Umair, and I am the treating physician for today. How may I address you? And after she tells you her name, you can tell that, okay, so you have come for the discussion about your child, about your child's health. Or you can say, if you already are going to pick the pitch in which you already are familiar with that guardian, you can say that, hello, my name is Dr. Umair, and I am the treating physician of your son. How may I address you? Or you can say that, how may I help you? So you have to do a little modification according to the structure of that role play. And I already told you to be confident, and don't be confused if there is something that comes out of the way. You just have to be confident and do that role play in a better way as much as you can, and believe me that you will ace that exam. Nothing to worry about it. So just be confident. Any other question, please? So any other question, please?
Hello, Dr. Umair.
Yes,
Can you hear me?
yes, sure, go ahead.
It's, I have a query regarding that. In emergency situation, like in general, in emergency, we don't take so much history about the patient and start the treatment as early as possible. So, in emergency situation, how we will introduce
Sure.
that? I want to ask in general, how will be an introduction in emergency situation?
So basically, this is also an important question. First of all, there is a very slim chance that you will get an scenario in which there will be an emergency situation. So even if you come across any role play in your exam, if there is an emergency situation, there will be a task, and you always have to introduce yourself. You will always open that pitch that, hello, my name is Dr. Umair, and I'll be your treating physician for today. How may I address you? No matter how much the emergency the situation is, if the patient is conscious, you're always going to open with this line, unless until there will be a very extraordinary scenario, extraordinary situation, and you can mold your opening line according to that situation. But there's a very slim chance that will happen, and I hope that it addresses your concern.
Yes, Dr. Umair, will we if we have to ask his name or not in this situation?
No, if you feel like that patient is conscious, you can always ask the name of the patient, because it will be helpful, and it will develop a rapport between you and your patient. And if that patient is unconscious, and if there is any guardian, then you can simply ask what is the problem with that patient. So that depends on the scenario, and believe me that there is a very slim chance that will happen.
Okay, thank you.
Thank you so much. So it was a very interactive session, and it went far better than my expectations, and I really loved it. And if you are looking to pass OET exam, if you are trying to ace it, we are there to help you. And we are trying to do as much as we can at Med Exam Expert. So if you have any queries, you can send us at our WhatsApp groups. And if you want to join our courses or our mock exams, which are very important, so you can contact our course coordinator, Ms. Ramesh, as well. So I hope that it was a very good session for you today, and you all learned new things, and we will be there to help you always in acing your exam. So thank you so much. It was a delight talking to you all. Take care. Have a nice day ahead.